Hi all, my name is Beverlyn Chenholm and I will be presenting Huntington's disease. What is Huntington's disease? It is an incurable disease that may develop over time, which deteriorates the cells in the brain, causing the individual to lose their ability to move, and over time their cognitive abilities will start to decline. HD is passed down in the family due to a HTT mutation that develops a DNA segment known as SAG trinucleotide repeat. This DNA consists of cytosine, adenine, guanine. When this segment is repeated within the gene 36 to more than 120 times, then it creates an abnormally long Huntington protein, which disrupts the normal functions of neurons in the brain, ultimately damaging certain sections of the brain. It only takes one parent with the defective gene to pass it down to their child, but it is a 50% chance that the child will not inherit the disease and a 50% chance for the child to inherit the disease. In rare occasions, a person can develop the disease without any history of the disease within the family. People that are diagnosed with Huntington's disease develop conditions in their 30s and 40s. People can develop conditions in their 20s, but this is known as juvenile Huntington disease. The symptoms of juvenile HD has similar symptoms to those that have HD as adults. There are a couple of disorders that develop as a disease progresses throughout the body, known as their ability to move, their thought process, and their behavior. Common signs and symptoms to notice in their movement is chorea. Chorea is a movement disorder that is common with patients that have Huntington's disease. It can cause a person to jerk their hands, feet, and arms involuntarily. This makes it difficult to keep a straight posture. Dystonia is another movement disorder in which the individual will create repetitive movements due to muscle spasms that can also affect speech and eyesight. For instance, the neck can involuntarily move to one side or cause their head to pull forward. The eyelids can blink rapidly and abnormally, making it hard for the person to see. Their jaw and tongue can cause slurred speech, drooling, and they may clench their jaw shut along with moving their jaw side to side. All these involuntarily movements can cause pain or injury due to all the actions. A common cognitive sign is perseveration, which is also common with people diagnosed with autism. It is being fixed on a topic and continuously thinking on a certain thought and finding it difficult to move on from it. Patients can act out without thinking, causing them to say or perform tasks that may be considered inappropriate to others that aren't aware of their disease. People with Huntington disease lack awareness of their own behavior and abilities. Also, memory can decline as the disease progresses, and it can become difficult to learn new information or to be able to multitask in simple day-to-day routines. An example of a challenge one may face is multitasking when eating. Holding a utensil to pick up food with one hand and using a knife on the other hand to cut their food can be challenging due to the jerky movements from chorea. As the disease develops, the individual can form little to no emotions when something good or bad happens to them, along with losing motivation to perform activities they once loved. They can have trouble falling asleep or staying asleep, causing them to feel fatigued and nauseated. There is no cure for this disease, and there isn't a way to prevent the disease from developing, but there are treatments and different types of therapy to support the individual and their family. The symptoms you see in juvenile Huntington's disease is similar to those we see in adults with HD. The only slight difference is that it is uncommon for them to develop physical jerking behaviors. Instead, it is common for them to have seizures. It is common for their muscles to become tense, which causes it to be difficult to relax their muscles. You may see their wrists stiffen inward with a turn like you see in the photo. Furthermore, the progression rate in juveniles is much faster than those that develop Huntington's disease as an adult. Juveniles can live up to 10 years after being diagnosed, while adults can live up to 10 to 25 years. There are treatments to help manage the symptoms and to assist the patient and their families throughout the process. An occupational therapist can assist with introducing assistive devices such as a wheelchair, cane, and walker for mobility, and OT can assist with creating a work plan focused on coping strategies for both the patient and their family. Medication prescribed by psychiatrists can help manage chorea, depression, and stabilizing one's moods affected by the disease. Physical therapy can assist patients by teaching them techniques to help them maintain balance and conducting exercise plans to help prevent them from falling. A speech therapist can help with communicative issues that will develop as the disease spreads to the muscles of the mouth and the throat. There are several ways of detecting if you have a Huntington's disease. If a person knows that they have a family history of Huntington's disease, then they can get blood tests done to see if the gene was passed down to them. If the person does not know that they have a history of the disease, a general physical exam can show possible symptoms of HD. From there, the physician will send the patient to get further testing done. A neurological examination, neuropsychological testing, and psychiatric examinations will be conducted to evaluate the diagnosis. These examinations will evaluate the individual's memory, reasoning, emotional states, and signs of distorted thinking. The physician may order brain imaging tests as well to rule out other possible conditions that may be causing other symptoms.